Welcome to the SABC News COVID-19 Global Wrap. I am Busisiwa Khadebe. This week, I bring you highlights of news which dominated headlines with regards to the coronavirus pandemic. But before we delve into it, let us have a look at some global stats. The world has over 165.8 million cases, with over 146.5 million recoveries and over 3.4 million deaths. South Africa has 1,625,003 cases, with 1,531,993 recoveries and 55,568 deaths. Staying in South Africa, the country on Monday started the second phase of the COVID-19 vaccine rollout with the aim of inoculating 5 million citizens aged over 60 by the end of June this year. Health Minister Dr. Zweli Mkhize says South Africa is expecting to receive 4.5 million doses of Pfizer and 2 million doses from Johnson & Johnson by the end of next month. The South African Medical Association has called on the health department to open more vaccine sites and ensure that the entire system is more efficient. SAMA says the COVID-19 vaccination rollout program for the elderly is long overdue. Meanwhile, the South African Council of Churches is calling on more religious leaders over the age of 60 to lead by example and get vaccinated against COVID-19. And lastly, a member of the Vaccine Committee for the World Health Organization, Professor Salim Abdul Karim, says contrary to some people's concerns that there's reduced protection from one dose, the delay in administrating the second dose makes the vaccine more effective. Karim says the evidence is preliminary that you can increase the gap of the Pfizer vaccine up to 3 months. On to the rest of Africa. The continent has now recorded over 4.7 million COVID-19 cases with more than 4.2 million recoveries, and the death toll stands at 127,962. African Union Commission Chair Moussa Faki Mahamat has told a virtual meeting of the United Nations Security Council that vaccine protectionism and nationalism are endangering Africa's social-economic recovery from the COVID-19 pandemic. Faki Mahamat was speaking during an open debate on addressing the root causes of conflict while promoting post-pandemic recovery in Africa. On Wednesday, Malawi destroyed 19,610 doses of AstraZeneca COVID-19 vaccines that expired 18 days after arriving, despite assurances from the African Union and the World Health Organization that the vaccines were safe until mid-July. Sudan will restrict all travelers who have visited India in the last 2 weeks, the country's health emergency committee said in a statement. This as India's total COVID-19 caseload topped 25 million on Tuesday. There are concerns about the spread of a new highly infectious B.1.617 variant first detected in the country. And lastly, experts appointed by Tanzania's new president, Samia Suluhu Hassan, have declared COVID-19 vaccines to be effective and recommended joining the COVAX facility that shares the inoculations. And in international news, in the United States, government and industry officials said President Joe Biden's administration has been weighing changes to travel restrictions that bar much of the world's population from coming to the United States, but has not reached a decision yet. Since early last year, the country has barred nearly all non-US citizens who have recently been in the UK and much of Europe, as well as China, Iran, and Brazil. This year, Washington added South Africa and India to the list. Meanwhile, In Texas, Governor Greg Abbott on Tuesday ordered all public school districts in his state to lift mask-wearing requirements next month, contradicting the latest student safety COVID-19 guidance from the U.S. Centers for Disease Control and Prevention. Abbott's executive order also bars other local government entities in the state from continuing to require face coverings beginning on Friday. Abbott said Texas was making strides against the COVID-19 pandemic through vaccinations, antibody therapeutics, and voluntary health safety practices, leaving government mask requirements no longer necessary. In South America, Brazilian senators on Tuesday accused the country's former foreign minister of undermining efforts to obtain COVID-19 vaccines after he used anti-China rhetoric during the pandemic. In a parliamentary inquiry, President into Jair Bolsonaro's handling of the coronavirus, senators blamed the president and his inner circle for delays in deliveries from China of active ingredients to make Sinovac biotech vaccine in Brazil. Throughout April, 85% of the vaccines administered in the country were from China's Sinovac. India's total COVID-19 caseload has now surged past 26 million. This, as a powerful cyclone, which struck on Monday, further complicates the health crisis in Gujarat, one of the states where the disease is spreading most quickly. COVID-19 tests have been administered to over 200,000 people, while efforts are being made to try to limit any spread of infections. The storm has also complicated efforts to tackle the coronavirus in the state as vaccinations were suspended for 2 days, while hospitals awaited backup generators to keep power running and additional oxygen supplies. Though the official count shows new infections subsiding, there are fears that the new, highly infectious B.1.617 variant, first found in India, is running out of control and in many cases, particularly in rural areas, are going unreported due to lack of testing. In Europe, Spain will allow people under age 60 who have received a first dose of AstraZeneca's COVID-19 vaccine to receive their second inoculation either with the AstraZeneca drug or with Pfizer Inc.'s vaccine. Until now, those who had received their first dose of the AstraZeneca vaccine were in limbo because government suspended that vaccine in March for the particular age group due to blood clot concerns. In Britain, ministers are considering contingency plans for local lockdowns or a delay to reopening after June 21. This is in response to concerns about the spread of the variant first detected in India. Under the restrictions, people would be advised to stay at home and non-essential shops and hospitality would be closed if the variant was not brought under control. And finally, a report by Public Health England revealed that 2 doses of the Oxford AstraZeneca COVID-19 vaccine are around 85% to 90% effective against the symptomatic disease, citing an analysis of real-world data from the rollout of the vaccine. In a weekly surveillance report, Public Health England said that the estimated effectiveness of the AstraZeneca vaccine, invented at the University of Oxford, was 89% compared to unvaccinated people. That compares to 90% estimated effectiveness against symptomatic disease for the Pfizer BioNTech vaccine. For the latest updates on the coronavirus, visit sabcnews.com.